New healthcare providers changing the way people access medical care. Zarcare is an online platform that connects patients with healthcare and wellness providers. Just how will this work? Well, let's get more insights from Annie Gwerengwe, founder and managing director of Zarcare. Annie, appreciate your time this afternoon. Now, just walk us through this experience. How does it all work? I know that for the longest time, people want to go to a health practitioner and be told that this is what is wrong with you, but you're taking a lot of that experience online.
Yes, thank you so much for this opportunity to talk about Zarcare. So it's an online platform, and simply put, it's a website that people can access and get connected to a healthcare or wellness service provider. And by that, I mean a general practitioner. It can be a doctor, a counselor, fitness trainers even.
So what inspired this novel idea?
Hugo, essentially it's about access. So it's about access and having options. And it's driven by a personal wish of mine, just to make it easier for me to get to a doctor, either for myself or for my children and other family members. And the mission when I set out to build this business was to help South Africa also have the same access to healthcare that is easy, that is convenient and online.
Now, you raise an important issue, and that's the issue of access to healthcare. And some of those individuals that have the greatest challenges in accessing healthcare are individuals that are in rural South Africa. How do they fit into the experience?
Well, all they need is a secure connection and connectivity for them to be able to access our website. You simply go on there and you register, and then they'd be able to connect to a service provider, but very much in the same breath, if we've got service providers who are in the rural areas and maybe have capacity to see other patients, they can use this as an efficient tool to connect to those patients.
Now, Annie, is there a limit to what illnesses or conditions can be dealt with on this platform? That's
an interesting question that I normally leave to the medical practitioners, the professionals to answer. I personally wouldn't want there to be a limit, but I think if we just think about it, just simply, if you are suffering from what you suspect is a heart attack or something quite severe that could be fatal, then an online consultation is not ideal. But if you have a sniffle and you know exactly, or you have an idea of the type of medication that you need, then online consultations are a better option for you. But I leave it to the doctors and to the other practitioners to be the ones to assess whether you are fine for an online consultation or whether they'll refer you to an emergency room.
Now, Annie, I'd imagine that in coming up with this business, you would have looked at some of its shortcomings. One of the shortcomings, obviously, is accessibility to the internet. If you're in a remote part of the country, or you're located in a remote part of South Africa, the other, I'd imagine, is children or babies, for instance, where a doctor might have to feel a certain part of the anatomy to assess the level of injury. What are some of the other limitations or challenges that you might have to overcome in the foreseeable future in this business?
Look, we live in South Africa and we face various healthcare challenges just as a country, as a whole. And there's unequal access, and other things that we need to deal with are the high costs of seeing a medical practitioner or wellness service provider. I mean, if you just think about seeing a psychologist and how mental health is an issue in our country, it's not something that is accessible to a lot of people. But if you use Zarcare, you're able to see counselors at a more affordable rate. There's also a shortage of healthcare professionals in certain areas, and what Zarcare does and is aiming to do is to just help with that access and have a broader spectrum of providers that people can access. And most importantly, it's just building a trustworthy community that people can go to when they need the care.
So I'm not just going on to Zarcare to get services of a general practitioner. There are other service providers on the platform as well.
Yes, there are. Would you take us through these? And I think the idea is about building a community, a trusted community. So if you come onto Zarcare as a patient or client, we call it members, as a Zarcare member, you're actually entering a community where you are going to get care, high quality care. If a general practitioner feels the necessity to refer you to a counselor, a dietitian, or fitness trainer, it can all be done on Zarcare. So it's a one-stop shop for your online consultations.
Let's talk about security and privacy for patients during an online consult. Have you had challenges with these, or what measures have you put in place to ensure that my privacy is safeguarded as I speak to a service provider online?
One of the unique propositions, the value propositions that we have is that as a Zarcare member, you're able to access your medical records at any time. When a practitioner sees you, notes are taken, prescriptions are scripted, and sick notes, and you're able to access that at any time, which you're not able to do right now with your doctor when you have face-to-face consultations with them, right? And we knew from the outset that this compliance and our compliance and just adhering to regulations and making sure that we have a secure and safe way of storing information was a priority for us. That was the first thing we set out to do. We have a compliance team that sort of did a risk assessment for us and ensures almost on a daily basis that we are adhering to that. So we guarantee that your information is safe. Our technical team is well experienced in ensuring data is safe.
So let's talk about service expansion. You've obviously are working in the South African market. Where else do you envision going? Are you looking to take this globally across the continent? I mean, we now talk about the African free trade area, which is an incredible opportunity. 1.3 billion consumers on the continent.
Absolutely. The continent is definitely a target of ours. We want to grow into Africa. We're in the process of negotiating partnerships that will help us grow into Africa. It's a priority of ours to make a social impact. It's not just about providing access. It's about making that social impact and playing a role in ensuring that people get the care that they need at an affordable price and easily and conveniently online.
Anna, you talked about a selling proposition a minute ago. So what sets you apart from other service providers that are looking to do the same or certainly similar services?
I think I've mentioned that we are out to create a community where you can trust the practitioners that are on there. And it's a broad spectrum of practitioners that you have on there. So not only will you have doctors, but you have all types of other practitioners that you can consult with. Also, I've used the term one-stop shop. In that when you become a Zarcare member, you actually, all the interactions you have with the practitioner and with us is done online. You would book your appointment on our website. You have the video call and the audio call on our website. Payment is securely done on our website, and all the communication and storage of your medical history is done on the website. And we guarantee privacy, we guarantee confidentiality. And in terms of the medical practitioners, the wellness service providers who want to use our platform or rather are using our platform, what they're enjoying is the ease of bookkeeping and booking of appointments, flexible scheduling, and managing the patients or clients that they are seeing. So it's a very efficient tool that the professionals can use to deliver that quality care that we aim to give to Africa.
Great. Well, that's one side of the story, where some of that success is for the practitioners that are coming on the platform. Well, let's talk about the other side, which is those that are members of the community, the patients or the individuals that are calling in to access certain services. Walk us through some of the success stories and some of the reactions that you've gotten from your clientele.
We've had such positive feedback. We've managed to connect hundreds of patients and clients to practitioners on our platform, and we continue to grow, and that really motivates us to enhance and optimize our platform. I think my favorite story is the South Africans who live outside of South Africa, so our expats, those in the diaspora, who come across Zarcare online and are just so excited that they can consult with a South African doctor, get their script in a much easier way than they could in the country compared to the countries they live in, and get a family member to collect that medication for them and get it sent, or maybe they're traveling here soon to collect it. So it's the convenience of actually being able to see a South African doctor when you're outside of the borders. And I think I'm quite proud of that, that we've been able to help people who are outside of South Africa.
You know, it raises an interesting aspect to the patient-doctor relationship. And it's interesting because if I call a health practitioner So wherever I am located across the globe.
Yeah.
And I have to speak to them in English, right, for argument's sake. And English doesn't quite describe the pain or the challenges I'm going through. But if I can speak to them in vernac, so to speak, then obviously it's more captivating. It's more fit for purpose, is it not?
You're spot on, and I think that's why we are so focused on getting as many practitioners onto the platform as possible, so that we can offer care in all types of languages that our users can confidently interact with the practitioners on our platform.
Well, it then raises the next question, is that if I'm accessing Zarcare, am I accessing it in English, isiZulu? What languages are available on the interface for users?
So that's an interesting question. I'd be keen to ask my team to do more work into it so that we can have the proper stats for you. But we do have a broad range of practitioners on there in terms of language. I know for sure there's English and Afrikaans, Zulu and Sotho, and I'm pretty sure there's more languages because right now we haven't had a query come to us where a user has said that they can't find somebody who can assist them. But as those requests come, we'll definitely address them. But at the moment, we're definitely on a mission to make sure we cover all our bases. It's an amazing offer to have in South Africa, I feel. We have to consider it as an important goal of ours.
I certainly think you need to. Any final thoughts? Talk to us about the costs. Maybe affordable healthcare is everything that everyone is fighting for, is all that everyone is fighting for, rather. How affordable is Zarcare?
I must say I like to use the word relatively affordable because of all the socioeconomic factors we have in our country, there's so many disparities and inequalities that we have, right? So relatively affordable. We have appointments that can be booked from 180 Rand up. You'll be able to see a counselor for that price. You can see a general practitioner for about 250 Rand. We try and keep that cost below 300 so that I think it's a more palatable amount compared to paying a higher price when you go to a face-to-face appointment.
Gwerengwe is founder and managing director of Zarcare. Appreciate your time this afternoon.